Okay, let's unpack this. We're doing a deep dive today into, well, a bunch of sources about those really tough wounds, the ones that just won't heal.
Right.
And specifically looking at something called hyperbaric oxygen therapy for selected problem wounds.
Mm-hmm.
Think of this as your shortcut to understanding where this therapy came from, how it works, and maybe how it could help when healing just seems, well, stuck.
Yeah, a way to get the key takeaways, whether you're dealing with a wound yourself or maybe caring for someone who is, or, you're just curious.
Exactly. So first things first, what are the sources actually calling a problem wound?
Well, it's defined pretty simply, actually. Basically, any wound that's just taking much longer to heal than you'd normally expect it to.
Longer than expected.
Yeah.
Simple enough. And the material seems to point a finger at a major reason why healing sometimes kind of goes sideways, doesn't it?
It does. A really key factor is often just not enough oxygen getting down into the tissue. Low oxygen levels.
Right. They use that analogy like a fire trying to burn, but there's just not enough air getting to it.
Precisely. That state, tissue hypoxia it's called, is a critical barrier. The body's repair systems just don't have the fuel they need to, well, to work properly.
Okay, so light of oxygen is the problem.
Mm-hmm.
How do you fix that? This is where hyperbaric oxygen therapy, HBOT, comes in.
That's the idea. And the history they mention is pretty interesting. It sort of traces back to divers.
Oh, yeah. Like Jacques Cousteau, I saw that mentioned.
Exactly. His teams and others noticed that cuts and scrapes seemed to heal better when they were living under pressure, like in underwater habitats.
Huh. So they connected the dots to pressure and maybe more oxygen?
They did. Science later figured out the mechanisms. So hyperbaric oxygen therapy essentially involves breathing pure 100% oxygen inside a special chamber.
Okay.
And the key is air pressure inside that chamber is increased, usually like 2 to 3 times higher than normal air pressure.
Gotcha. So going back to that other analogy they used, if healing is like an engine and oxygen is the fuel, normally your blood delivers the fuel. This therapy sounds like putting the engine in a pressure cooker and force feeding it this super high octane, pure oxygen fuel, especially to the damaged bits where maybe the normal fuel lines, the blood vessels, aren't working so well.
That's a really good way to put it. A turbocharged boost is what they called it. And the sources explain how that extra oxygen delivered under pressure helps so much. It's not just, basic fuel.
Right. It does more.
Yeah, quite a bit more. First, it directly helps fight off certain kinds of bacteria, which lowers the risk of infection, a huge problem in non-healing wounds.
Okay. Fighting infection. Makes sense.
Then it stimulates the cells, fibroblasts that build new tissue. They make collagen, which gives skin its strength. So better rebuilding.
Ah, so building blocks too. What about those fuel lines, the blood vessels?
That's another big one. It actually encourages the growth of new tiny blood vessels into the wounded area.
Oh, wow. So it helps fix the delivery problem long term.
Exactly. That's called neovascularization. It improves circulation to the tissue over time. Plus, it helps reduce swelling and inflammation too, so it tackles several problems at once.
Okay, so it's doing a lot. Which specific wounds, then, do the sources say this really helps with? Where's the strongest evidence?
Well, the material really highlights diabetic foot ulcers. That seems to be a major focus.
Yeah, those can be incredibly serious.
Incredibly serious. And the compelling thing isn't just that it helps them heal better, which it does according to the sources, but that it significantly reduces the risk of needing a major amputation.
Wow. Reducing amputation risk. That's huge. That's potentially life-changing for someone.
Absolutely. But it's not only for diabetic foot ulcers. The sources are careful to say it's considered for selected other difficult wounds too.
Selected being the key word there.
Definitely. The evidence might vary a bit more for these others, but it includes things like ulcers from really poor artery circulation, arterial insufficiency ulcers, and also some quite rare but nasty conditions like calciphylaxis or pyoderma gangrenosum. Even some ulcers related to autoimmune issues like scleroderma or complex wounds after surgery, or sometimes in sickle cell disease.
So, a range of tough cases, but it sounds like it's definitely not a first-line treatment for just any cut or scrape.
Oh, absolutely not. The sources really emphasize that careful patient selection is critical. It's not presented as some kind of magic bullet.
Right. And doctors actually measure oxygen levels in the tissue sometimes, don't they, to help figure out if it's likely to work.
Yes, that's one of the tools they use to predict who might benefit most. It helps guide the decision.
And importantly, this is used with standard wound care, Not instead of it, correct?
That's a crucial point they make. It's an adjunct therapy, meaning it's added on top of all the usual important stuff like cleaning the wound, proper dressings, managing infection, controlling blood sugar if it's diabetes, the foundational care.
Right, you still need all that. This is an extra boost for specific situations.
Exactly. It's an advanced tool for when the standard approach just isn't getting the job done because of those underlying issues like poor oxygen supply.
Okay, so pulling this all together then, what our deep dive shows is that, yeah, standard care is absolutely the baseline, the foundation.
Always.
But for certain really complex wounds that just aren't healing, especially critical ones like those diabetic foot ulcers where amputation is a real threat, hyperbaric oxygen therapy offers this powerful extra tool.
A way to overcome those roadblocks.
Yeah, basically giving the body's own healing systems a massive oxygen boost under pressure to get past problems like bad circulation or stubborn infection. The real takeaway seems to be it's about matching the right therapy to the right wound based on a careful assessment.
Well said. And looking at how effective this can be, it kind of leaves you wondering, doesn't it?
Wondering what?
Well, could harnessing this simple fundamental thing, increased oxygen, potentially unlock healing for even more types of stubborn tissue damage in the future? It really makes you think about the power of oxygen.